Good evening, everyone. Hello, this is Dr. Sai Shri, pathologist, and today we are discussing the pathology and genetics. And a very first of all, a very warm welcome to the uh, webinar conducted by Prakara, the Potential and Realized. So, hope all of you are doing well and having this good evening and enjoying the holidays. So now in this webinar, we are going to discuss the important questions in pathology and how the question paper model of the pathology is being discussed today. So uh, let us start the topic and learn a few things. So today, we have 5 units to discuss what are the important questions in these topics and what are all the questions frequently asked in these topics. Okay, these are the 5 units in pathology we are going to have in this pathology subject. First is introduction, special pathology, and third unit is clinical pathology. And fourth unit, examination of the body cavity fluids and transudates and exudates. And fifth unit is urine and feces. So let us discuss about the first unit topics, what are there in that. So here are the some weightage units which in which more frequently asked questions are more. So these 2, 3, 4 units are very important. So more questions are being asked from these units. Those are Unit 2 Special Pathology, Unit 3 Clinical Pathology, and Unit 4 Examination of the Body Cavity Fluids, Transudates and Exudates. So these are the weightage units which you need to concentrate more than other units. So first is the introduction, in which you're going to learn about some terminology in the pathology, like what is the term metaplasia means, what is the term dysplasia, what is the term hypertrophy, and what is the etiology, what is the pathogenesis. All these terminology definitions you are going to learn in this unit. And what is the importance of the study of the pathology? So why we need to learn pathology? Because this is the basic subject which you need to know before diagnosing a disease. Before you want to treat the patient, you have to learn the pathology first, then you can diagnose the disease and then treat the patient. And then definition of these terms which I have already told. And next, methods and techniques. So there are certain techniques and methods in the pathology, so with which we do some tests and all. So all these methods and techniques are being discussed. And tissue and cellular changes, infiltration and regeneration, inflammations, infections, and wound healing. So all these chapters under this unit, all these chapters are discussed. So we have to concentrate more on the inflammation, infection, and wound healing, because these topics are more important for exams. And okay, let us proceed to the next slide. So these are the vascular changes, cellular growth, neoplasms, normal and cancer cell, benign and malignant growths, what is in situ carcinoma, and what are the disturbances of the fluid and electrolyte balance. So all these are topic names. These topics are being discussed in this unit. So these are being in detail discussed in the main classes. Okay, and um, so coming to the frequently asked questions in the unit 1. So what are the differences between transudate and exudate? So basically in this question you have to draw a table, it would be a better representation. uh, you have to write the differences between transudate and exudate in a tablet form. So in transudate is mainly a filtrate, ultrafiltrate of the plasma without any changes in the endothelial permeability. And in exudate, so this is due to infection or inflammation, and it is associated with the vascular changes, that is increased in the vascular permeability. And sorry. And next, some changes between the both. The differences means low protein content in transudate, high protein content in the exudate, and glucose will be same as in plasma in transudate, and it will be low in exudate. So like that, you have to write everything like specific gravity, pH, and the cellularity, which is less in transudate and more in exudate. So next, coming to in situ carcinoma, and is the characteristics of a cancer cell. So how will you identify a cell as a cancer cell? So first you need to know how normal cell looks to differentiate between the normal cell and the cancer cell. So, for a cell, if you have nucleus, cytoplasm, and the cellular membrane around it. So, in a cancer cell, the nucleus will become bigger in size, and the membrane will be very irregular. And sometimes we can see prominent nucleoli in the cell. And you have the hyperchromatin. The chromatin will become increase in color, increase the intensity. This is hyperchromatic nucleus. So these kind of characteristics you have to list out. And what is in situ carcinoma? In situ carcinoma is like it is not invaded into the stroma of the tissue. So it is confined to within the basement membrane, and within the basement membrane, the cells will become dysplastic with all these characteristics, but it is not reached into the stroma of the tissue. And what are all the stages of the wound healing? So wound healing will have certain stages, like first stage will be inflammation, and second stage will be proliferation, and third stage will be remodeling. And you need to explain each step with some flowchart better, because reading a paragraph will be boring for everyone, right? So if you draw a flowchart and write the points, it would be better for you to explain in a better way. So, what are the consequences in vascular changes during a injury? So, what are the vascular changes in any inflammation or occur or injury occur? The first thing you need to see is the vasodilation, and then change in the rate of blood flow, and the stasis, slowing of the circulation, and then changes in the bloodstream and immigration of the white blood cells to the site of the injury, and then diabetes of the white blood cells to the site of the injury. All these steps, you better if you draw a diagram and flow chart for the representation in the exam. Okay. And then explain the forms of cell adapting after injury. So there are certain changes which the cell will adapt after the injury. For example, so in a pregnancy or a puberty, the breast size will increase, because the lactation after the pregnancy, the breast should be hypertrophied, and hyperplasia of the breast is necessary for the lactation. And to have the fetus in the uterus, the size of the uterus should grow. That's why the hypertrophy of and hyperplasia of the muscle in the uterus also will occur. So these are the changes which will occur. And sometimes in GERD disease in the esophagus, so when these changes occur, the squamous mucosa of the esophagus will be converting into columnar epithelium. So this is called metaplasia. So all these are adapting changes after the injury. So what if the cell after injury, if it is not adapted, it will get necrosed or apoptosis based on the condition, whether it is physiological or pathological. So next is the special pathology unit. So we have different systems in the body, right? So under these special pathology, we will be discussing the respiratory tract, in which these topics are discussed, like tuberculosis, bronchitis, pleural effusion, pneumonia, lung abscess, emphysema, bronchiectasis, bronchial asthma, COPD, and tumors of the lung. So all these topics are discussed under the respiratory tract. So next system is CVS, cardiovascular system. So in this system, these topics are being discussed: pericardial effusion, rheumatic heart disease, infective endocarditis, atherosclerosis, and aneurysm. Next system is GIT. In gastrointestinal system, there are so many topics. First topic is peptic ulcer, which is the most common condition we see, and typhoid fever, and carcinoma of the GI tract. GI tract is very bigger, right? So starting from the buccal mucosa, esophageal, gastric, and intestinal, all these carcinomas are discussed. And next, liver, gallbladder, hepatobiliary system, liver, gallbladder, and pancreas. All these are discussed with the headings of hepatitis, chronic liver abscess, cirrhosis. Next, tumors of all these three: liver, gallbladder, and pancreas. And the most common condition of the gallbladder, cholecystitis, is also being discussed. And next system is kidneys and urinary tract. So glomerulonephritis, which is the most common condition for renal failure, and pyelonephritis, renal caliculi, renal carcinoma, and cystitis. Cystitis is the inflammation of the bladder. So in kidneys and urinary tract, these few topics are discussed. And then male genital system. In male genital system, we are going to discuss about cryptorchidism and testicular atrophy, carcinoma penis, and prostate testis. So all these are discussed in the male genital system. Next system is female genital system. In this system, we are going to discuss about fibroids, which are the most common condition for which hysterectomies are being performed these days. So carcinoma cervix and endometrium, vesicular mole, choriocarcinoma, ectopic gestation, ovarian cyst, and tumors. And finally, carcinoma breast is also discussed in this system itself. Our next system is CNS, Central Nervous System. Under these system, inflammatory conditions like hydrocephalus, meningitis, encephalitis, vascular disorders, in which thrombosis and embolism are discussed, and then stroke, paraplegia, quadriplegia, tumors, meningiomas, and gliomas. Most common tumors in the CNS are being discussed. So let us go to this, where frequently asked questions are discussed. So write the etiological changes and clinical features occurring in the TB. So what is the etiology and pathological changes? So first of all, in etiology, it is a bacterial infection, right? It is spread through person to person, you during coughing and uh, towels and contact with respiratory secretions, whatever. And pathological changes are So in TB, what is the pathological changes? Most commonly we see granulomas where epithelioid cells which are activated and fight with the bacteria, forming granulomas and germ cells and causing necrosis also. So for this also, first you need to put the heading, what is the etiology, and then pathological changes, and what is the clinical features: cough more than 2 weeks, fever, loss of appetite and loss of weight, uh, expectoration of the sputum. So all these things you have to mention in a heading wise. First is the etiology, pathology and clinical features. Next is the explain pathophysiology and clinical features of rheumatic heart disease. So rheumatic heart disease, the mostly how it develops after a rheumatic fever, which is caused by group A beta hemolytic streptococcus organism. If it is untreated, it transforms to rheumatic fever. And in rheumatic fever, as a complication where heart is involved, all the three layers of the heart is involved, and mitral valve is the most common valve in which get affected in the rheumatic heart disease. So all these changes you have to mention. So and then valvular, due to the effect of the valvular regurgitation occurs, which can lead to heart failure. So all these changes you need to mention pathophysiology and clinical features separately, point wise. And then etiopathiology and clinical features of gastric cancer. So gastric cancer is caused by some mutations, and also as also a complication of bacteria H. pylori, Helicobacter pylori infection, which can lead to gastric cancer in the infected mucosa. And the mutations like microsatellite instability and p53 mutation, APC mutation and beta catenin mutation. All these mutations can lead to gastric cancer. So first, how these changes will occur? First, low-grade dysplasia will occur, mild change in the morphology of the cells, and then high-grade dysplasia will occur, marked changes but not invaded into the stroma, and then it becomes cancer, carcinoma, which is invading into the stroma. So, what is the next question? Explain the etiology and clinical features in the hepatitis. So, hepatitis, most common cause of hepatitis is in India. It is mostly due to alcohol. Alcohol can lead to hepatitis, and viral etiology, hepatitis B and hepatitis C, all viral hepatitis A, B, C, and E, all these causes hepatitis. And what is the pathology? After invading of virus into the hepatocytes, it causes hepatocellular injury, and it will lead to inflammatory cell infiltrate around the portal tracts. Ultimately, it causes cholestasis, the deposits of this cholesterol in the hepatocytes, and causes fatty change and injure the liver. Okay. And what is the next question? It is explain the etiology and clinical features in encephalitis. What is encephalitis? So the etiology can be primary or a secondary. So in infections, the most common infection causing encephalitis is herpes simplex virus. So then Epstein-Barr virus and some infections like measles also can cause encephalitis. You need to list out the causes, and then you should go to the pathology. In pathology, the infection, it is the infection of the brain. So the brain parenchyma is infected. Anything which is infected will lead to inflammation. So here also the brain tissue will become inflamed, and it causes dysfunction of the neural cells, which leads to degenerative changes and damage the brain. So you need to explain in detail in the exam what is the pathology and the etiology. And what are the clinical features? Clinical features include headache, seizures, and some neurological symptoms, like with if it is with neurological deficit, neurological symptoms also can occur. So you need to explain in detail all the clinical features, right? And then etiology and clinical features in the glomerulonephritis. So of the glomerulonephritis, so what is the most common cause? Here also this is post-streptococcal glomerulonephritis is the most common type in the glomerulonephritis. So when it is here, the glomerulus is injured, it is again inflamed, and the function of the glomerulus will be affected, which can lead to symptoms like proteinuria and hematuria, blood in the urine and proteins in the urine. And then decreased GFR can causes glomerular filtration rate will be decreased in glomerulonephritis, which can lead to increased blood pressure, oliguria, and edema, and is azotemia. Azotemia means increase in the blood urea nitrogen. So all these changes will occur in the glomerulonephritis, and here also for everything you need to put side headings and then elaborate the question. Explain the etiology and clinical features of the brain tumor. So we have what brain tumors we have discussed earlier, meningiomas and gliomas. So these are the most common brain tumors. And if it is primary, what if it comes from the other tumor in the body, that is metastasis. Okay, this anything, it is a lesion in the brain, right? So it is a space occupying lesion, so which leads to the enlargement of the tumor. Brain tissue will be compressed, and which causes ischemia and necrosis. And due to this high pressure, the edema and the increased intracranial pressure also occurs, which leads to the herniation of the brain. So all these are due to space occupying lesions. So if it is due to metastasis, what is the most common tumor which gets transferred to brain or metastasis to brain? It is the lung. Lung is the most common tumor which get metastasis to brain. And then next comes breast, melanoma, and renal also. Okay. Next, what is the etiology and the clinical features of in the tumors of brain? So etiology and tumors, these are different types of bone tumors. It can be benign and it can be malignant, and if it is, it can be metastasis of the other primary tumors. So what are the benign tumors? First, like osteochondroma, giant cell tumor, osteoid osteoma. All these are examples of the benign bone tumors. And then coming to malignant tumors, the sarcoma word osteosarcoma, chondrosarcoma, and then Ewing's sarcoma. So these are the most common examples of bone tumor. And what are the main tumors which get metastasis to bone? Like breast in the females and prostate in the males, and then thyroid and kidneys also can metastasis to bone. So what are the clinical features? So clinical features could be um, based on the site of the tumor, right? If it is near the joint, the movement will be affected, and the bones will become stiff, and the regular carcinoma symptoms like weight loss, anemia, fatigue, everything you can get. And due to the tumor, it weakens the bones, so we can have pathological fractures due to these tumors. So these are the clinical features. So in detail, you have to explain all these things. Then coming to etiology and clinical features in the benign prostatic hyperplasia. So, what is the etiology? It could be due to more hormonal changes in the old age, which occurs, and it could be due to arteriosclerosis in the old age and some nutritional imbalance. So, coming to the symptoms and signs, so reduced flow of the urine due to the obstruction caused by the prostatic hyperplasia, and then nocturia and incomplete incontinence, hematuria, all these urinary symptoms, the lower urinary tract symptoms can occur due to this hyperplasia. Coming to the pathology, so the stroma here in the hyperplasia, the stroma will become, the prostate will become hard and forms nodules. The stromal nodules you can identify under the microscopy in the case of benign prostatic hyperplasia. And coming to the next question, etiology and clinical features in the renal failure. So, what would be the etiology? Anything can lead to this glomerular, all types of glomerulonephritis. When it comes to the end stage, it will ultimately lead to a renal failure. Even diabetic nephropathy also can lead to renal failure. So in renal failure, again the decreased GFR will occur, and then it leads to inability to concentrate the urine, and the loss of function of the nephrons, and then it non loss of this excretory functions like oliguria, anuria. So all these symptoms of the renal failure will occur. So this the other symptoms we includes hypertension, like increased BP and altered consciousness because of this azotemia, increased blood urea, nitrogen in the renal failure. The CNS symptoms also will occur. Coming to clinical pathology, the third unit. So, what are the various blood and bone marrow test in assessment and monitoring of disease conditions? Principle, procedure, reading of the result. So, these are the units, these are the topics which are discussed in this unit. First is hemoglobin. How will you identify the amount of the hemoglobin by some methods, and RBC, WBC, and platelet counts. How their morphology will be like, and how the counts will be done with manual method or automatic. So next one is bleeding time. The coagulation profile includes bleeding time, clotting time, prothrombin time. And next, blood grouping and cross matching. And next, blood culture, serological test and immunological tests, and examination of the bone marrow, and how will you collect the blood specimen for various departments like clinical pathology, biochemistry, and microbiology. So, and how will you read the values, and what are the normal values which are very important. So, all these topics are discussed in this unit. So, let us discuss some frequently asked questions in this unit. Okay, what is the method of testing for blood group detection? So basically there are two methods. One is the slide method and next is the tube method. And routine testing we use slide method for detection of the blood groups. So what are the blood groups we have routinely and most commonly blood group? So we have A group, B group, AB, and O group. O negative blood group is the universal donor. And what is cross matching? Name diseases screened in the donors. So in cross matching, we have to test a blood bag with the recipient's blood. So when the cross matching is compatible, then the blood bag is given to the recipient so that no reactions occur after transfusion of the blood. So, name diseases screened for in donors. So there are diseases which can be transmitted due to with blood, giving the blood to the recipient. So the blood bag should be screened properly to prevent PNC, and syphilis will be screened, and after that only we have to approve the blood bag to the recipient. Okay. So next question will be explain the method of testing for hemoglobin using using Salis hematometer. So you need to explain the whole test and how will you the process of the test, like with how will you fill this Salis HP tube up to what mark, like it is filled up to the mark 2 with 0.1 N HCl, and then you have to add 20 microliters of the blood from a from HB pipette. So then we have to stir with the stirrer. So then you have to add some distilled water drop by drop. So then you have to read with the comparator, which will be in the side of the Salis symptometer, and the our sample will be in the center. So then you have to compare the color of the sample which we have added with the others, so that we can identify the amount of the HP in the sample at the upper meniscus. Okay, and coming to the next unit, examination of body cavity fluids, transudates and exudates. So laboratory test used in the CSF analysis. Examination of other body cavity fluids, transudates and exudates, sputum, wound discharge, analysis of gastric and duodenal contents, and how will you analyze the semen sperm count, motility and morphology, and their importance in the infertility. So next topic is methods of collection of CSF and other cavity fluids, uh, cavity fluid specimen for various clinical pathology and various departments, biochemistry and microbiology test, inference and normal values. So what is the examination you do for gastric analysis? So to assess the on gastric fluid analysis, what we are going to read. So we are going to examine for basal acid output, the amount of acid secreted without any external stimulus like visual, olfactory or auditory, without any external stimulus, what is the amount of the gastric acid is being secreted. And then maximum acid output. So it is following stimulation with pentagastrin. What is the maximal acid output we get? So first we have to we have to examine 4 samples. First 4 sample in gap of 15 minutes are analyzed after stimulation with the pentagastrin, and then peak acid output. So it is calculated from first 4 15-minute samples. It indicates greatest possible and secretory capacity, and it is preferred over the maximal acid output. So next question would be name the sites of CSF and examinations done on CSF with inferences. So this is the, as far as I know, this is the most important question, which is mostly asked for essay question. Also here it is asked for short notes, so you can write little bit briefly, but if it is asked for essay, you need to, they will ask what are the whole examinations you do on CSF and how will you collect the sample. All these topics are being asked. So site would be most commonly we collect from L3 and L4 gap, L3 junction of the L3 and L4. The spinal with the help of lumbar puncture needle or spinal needle, it is inserted between third lumbar vertebra and fourth lumbar vertebra and collect the sample. And how will you examine what are the examinations done on CSF with inferences? So the examinations would be done for first thing is any fluid we have to examine physical examination examine. Fluid you have to tell the amount of the fluid you have received. This is all comes under physical examination. And then coming to this chemical examination, you here we examine the amount of glucose and amount of proteins present in the and LDH value amount. All these parameters are examined under chemical examination or biochemical examination. Next, microscopic examination. This is very important because in CSF the cellularity is very low and it is increased only during the any infections or inflammation. So you need to count how many cells are present in the CSF cell count. So what is the amount of WBC, RBC, and again under WBC you have to count how many if there are different types of WBC present in the sample. We have to mention how much neutrophils, lymphocytes, everything. What are the different types of cells present in the CSF? Sorry for the interruption. And then, mm so where we are? Okay, we are discussing the cell counts. Cell counts needs to be discussed in the microscopic examination. And then microbiological examination. In microbiological examination, so we have to tell any bacteria and virus present in the CSF. So in that, so one sample will be sent to the microbiology department, one sample will be sent to the pathology department, and one sample to the biochemistry department. So all these parameters which needs to microscopic examination. Okay. Examinations done on semen and list the abnormalities observed. So, why we'll do the semen analysis? The basic concept behind doing semen analysis is to tell the sperm count. So, persons with the infertility problems, so they come for semen analysis to analyze the sperm count, the morphology of the sperms. So, because the oligospermia or azoospermia is the most common cause for the infertility, so there are parameters examined in the semen. One is the microscopic examination, that is how much amount of the fluid we have received and what is the color and what is the liquefaction time and the pH of the semen. So after this, it then goes to the microscopic examination. Microscopic examination, we see how many sperms are present per milliliter of the semen. So what is the normal count of the spermatozoa in the per ml of the semen? It is 15 to 20. It should be minimum 15 or 20 per ml is the normal value. So less than 15 we give it as oligozoospermia. And then motility of the sperms. More than 50% should be motile for the normal motility of the sperms. Okay. And then, and progressive motility. Progressive motility should be, that means the sperm should be continuously moving from one end of the microscope to one end of the field to other end of the field. That means the sperm is not just moving here, and it is mobile throughout the cavity. So that's like progressive motility, and it should be more than 25% to give it as normal. And what are the normal morphology? Morphology of the sperms. What is the normal morphology? You should have a head, body, and tail, and you should have an acrosome. So what we see is head and tail end of the spermatozoa. So there are morphological abnormalities where only head we can find, or very only tail you can find. All these are morphological abnormalities. So to give it as a normal sample, we need 30% of the spermatozoa should be normal in morphology. And then viability. So not all the sperms present in the semen are viable. So some are dead and some are viable. And we need at least 75% of the spermatozoa should be viable in the fluid. Okay. And then the inflammatory cells, RBC and WBC. The RBC should not be present usually, and WBC, if present less than 5, is acceptable. More than 5, we see only with the infections. So all these are parameters we observe in the semen. So absence of the sperm count, we give it as azoospermia, and if it is less than 15, oligozoospermia. And if it is not moving properly and the mobility is less, it is called uh, asthenozoospermia. And the morphology is less, it is morphology is not normal, it is teratozoospermia. This is all terminology given to describe the abnormal parameters of the spermatozoa in the semen, right? So next, what is the examinations done? What are the examinations done on pleural fluid with inferences? So basically, we have already discussed the differences between the transutate and exudate, right? So in this pleural fluid also, we have the pleural fluid examined because of pleural effusion, right? Because the fluid will be pulled in between the pleural layers. So then we need to examine whether it is due to malignancy, or whether it is due to infection or some other cause. So there are two types of effusions: malignant effusion or infective effusion, which is differentiated by transutate fluid or exudate fluid. So these parameters we have already discussed, right? The difference is conditions. In which conditions you will get this transutate kind of fluid: heart failure, liver failure, renal failure. In all these conditions you will get transutate kind of pleural effusion. And when there is infective etiology, we can get exudative type of pleural effusion. So next, coming to the examinations done on sputum with inferences. So what we do on the sputum is examined most commonly in TB, right? So in TB, we need to examine how many acid, if it is TB positive, we have to examine the number of acid fast bacilli present in the sputum. And then it is also same, the how the physically it is, how much amount of sputum we receive, what is the color of the sputum, because based on the color of the sputum also we can tell some conditions, if blood mixed sputum, or rusty colored sputum, or greenish sputum. So based on the color of the sputum also, there are some differential diagnosis which we can give. So that's it. And then Coming to urine and feces, fifth unit. So, in this unit, we are going to discuss the physical characteristics, culture, sensitivity of the urine, and analysis of the urine. And coming to this feces, we need to go. We are going to discuss this occult blood, ova, parasite, cyst, reducing substances present in the stool. So all these parameters in the stool we are going to discuss in this unit. And then how will you collect the sample of the stool, and how will you, what is the inference and normal values present in the stool. These are the basic topics we are going to discuss in this unit, right? And then these are the most frequently asked questions in this unit. So, first question will be explain the test done for urine sugar and ketone bodies. So, this is the basic test you need to know in the urine chapter. Okay, first for urine sugar we do a test called Benedict's test. So, and for ketone bodies, we do a test called Rothra's test. So, you have to explain the test. First, the principle of the test, and then method of the test. How will you do? So, I'll just tell in brief how will you do the Rothra's test for ketone bodies. So the basic principle of this test is the ketone bodies, that means the acetic acid and the acetone which are present in the body, it will, that means which are excreted in the urine. If present in the urine, it will react with the nitroprusside which we are going to add in this test in the alkaline solution to form a purple colored ring or complex which will form a ring around in the urine sample. So this is the basic principle in this test. So how will you, what is the method? So you have to take the 5 ml of the urine in a test tube, and then we have to saturate with ammonium sulfate, and you should add the small crystal, the main thing, sodium nitroprusside is added into the test tube. And then the Lecker ammonia will be present, which is also a part of this test. So all these are components of the test. So you have to describe this also. What are the things needed for this test and principle of the test, and then method of the test. So this slowly the Lecker ammonia is done along the side walls of the test tube. So if the urine sample contains these ketone bodies, immediate formation of the purple colored ring between the two samples will be present. So then we give it as the ketone bodies are positive for in the urine, and the name of the test is Rothra's test. Okay. So like in this way you have to explain the test. And next question will be explain the examinations done on faces with inferences. So what is the main test you do for this feces? Basically, you will examine feces for any parasites. The basic thing behind examination of feces is parasites. Sometimes the eggs of the parasites will be excreting in the stool sample. So if you identify the egg in the stool examination under the microscopy, here you can tell these parasite egg is identified in the feces, so that they can treat the patient with the anti-parasitic medicines. Okay, and explain the methods of collection of the urine. So collection of the urine, it contains first is the random examination, like any random sample. When you go randomly to the hospital, you can't give your first morning sample, it is a random sample. So that is a random specimen. And next one is the first morning. Some tests need specifically the first morning sample. And next is midstream clean cat specimen. So next thing is the timed collection, like 24-hour urine sample. It is needed for sometimes for 24-hour urine protein examination. So that is the timed sample. And then catheter examination. So the urine present in the catheter are examined, is collected and examined. And then suprapubic aspiration, when the urine is not getting excreted into the catheter, or it is when the patient is not urinating, we will go directly into the bladder and aspirate the urine. Okay, and that is also one of the uh, kind of collection and specimen for the urine examination. And then explain the examinations done on urine. So here also we have already discussed, right? What are the examinations we do? We examine physical examination, chemical examination for glucose, proteins, and specific and so ketone bodies and bile. This comes under chemical examination. And then microscopy for any bacteria and number of cells present in the urine. So all these examinations will be will be performing on the urine sample. So next is the genetics. So in the question paper, the minor component will be the genetics and the major component will be the pathology. So we need to know what are the topics present in the genetics. Uh, so here I am going to tell you one thing, because there are very few questions are being asked from this topic. We can't tell what is the important topic, because in these 5 units they may pick any topic for the questions. So every topic is important, but it is the minor component in the question paper. So first will be the introduction to the genetics. Second unit discusses about maternal, prenatal, genetic influences on the development, defects and diseases. And third unit will be genetic testing, which is performed on in the neonates and children. And fourth unit will be genetic conditions of adolescents and adults. And fifth unit, services related to the genetics. So all these are the topics which are discussed in the genetics. So in introduction, they're going to discuss in this topic the practical application of the genetics in nursing, and then impact of the genetic condition in the families. So there will be a lot of impact in the families, because if they come to know any genetic condition that is running in the families, they families will affect socially, psychologically, economically, and emotionally. All these can affect the families of the patients. So review of cellular division. So there are two types of division, right? Mitosis and meiosis. And what are the characteristics and structure of a genes, normal genes? And what are the chromosomes and sex determinations and chromosomal aberrations? My next, patterns of inheritance. So we have 4 patterns of inheritance, right? One is autosomal dominant, autosomal recessive. Next, X-linked dominant and X-linked recessive. So all these are 4 types of inheritance. Next, Mendelian theory of inheritance, and multiple alleles and blood groups, and sex-linked inheritance, and mechanism of inheritance, and then errors in the transmission, that is mutation. Okay. So these are the frequently asked questions. For example, what is the definition of the mitosis? It is a process where a single cell will be dividing into the two, and it will have the same kind of chromosomes as the parent cell has. Okay. And then types of chromosomal aberration. So it can be a numerical aberrations and structural aberrations. Like structural means there will be deletion of the genes, adding of the genes, and inversion of the genes, and translocation of the genes from one chromosome to another chromosome. So in numerical, the number of chromosomes will be different. Like we're all diploid, right? 46. In these aberrations, some persons will be 47, 49, like that. Okay. Name 4 diseases caused by the gene mutation. So some 4 diseases, for example, Down syndrome, Fragile X syndrome, and cystic fibrosis, sickle cell anemia, All these are genetic conditions in which mutation occurs. And what is the role of the nurses in genetics? And at least some four impact. I have already discussed this question. There will be some social, psychological, physical, and cognitive, and economical effect of the effect of and on the families, because once they come to know that they are having genetic disorder, though the family will feel guilt. That is the psychological effect. And economic effect, because most of the genetic testings are very costly tests, so every person cannot afford it, so economical effect will be there. And then second unit. So in second unit, we are going to discuss what is the maternal age, conditions affecting the mother, genetic and infections, consanguinity, prenatal nutrition and food allergies, and maternal drug therapy. Prenatal testing and diagnosis, effect of radiation, drugs, and chemicals on pregnancy and infertility, spontaneous abortions, what are the neural tube defects, and what is the role of folic acid, which will be lowering the risks of neural tube defects, and Down syndrome. So, what is these are some important questions asked in this chapter. First is the infertility. Infertility, it is unable to conceive even after unprotected sexual intercourse for whole 12 months in a year. So after that, we will call it as infertility. What is a teratogen? Teratogen is the thing which terato means the morphology, which is affected, right? The form is changed. The things which change the morphology and which change the uh, um, effect of the baby's structure and structure of the body and face is called teratogen. This can call birth defects in the fetus. Then next, define spina bifida. So in this thing, it is failure of closing of the neural tube will occur. This embryonal neural tube will be incompletely covered, so that the part of the spine will be exposed outside, which is where it is open and unfused. So then the spinal cord can protrude if it is a large defect through the opening, and there may or may not be a hydrocephalus, but it is a spinal cord will come out of the opening and exposed to outside. And then define Down syndrome. Down syndrome, it is usually a trisomy of the 21st chromosome, where the X chromosomes will be, sorry, not the X chromosomes. It is a 21st chromosome will be triploid. Name four drugs which have harmful effects on fetus. The first thing is alcohol. Uh, so alcohol should be avoided in pregnancies which are alcoholic females during their pregnancy. They should avoid alcohol because it can cause defects like microcephaly, like a small head of the fetus, and heart defects in fetus. And then valproate, it is a drug used for seizures, right? So when a patient is having seizures and they are on valproate, so if the female patient got conceived, the drug should be changed to switch to non-teratogenic anti-epileptic, because this valproate can cause the mandibular abnormalities and ear abnormalities. And right then next, cocaine. Cocaine also causes vascular disruption. So next unit is genetic testing in neonates and children. So screening for congenital abnormalities, developmental delay, and dysmorphism. So define dysmorphism. These are the most frequently asked questions. Change in the shape, structure. This is called dysmorphism. List four assessments done for the motor development in the baby, in the infants. So motor development, actually, for the 3 months, the baby snake will be stable, and there are some assessments where at 1 year, and the children should walk upstairs, and second year downstairs, and fourth year they should be able to hop. Based on this milestone achievements, the assessment of the motor development will be discussed. And list four congenital disorders. So all these we have already discussed, like the thalassemia, sickle cell anemia. All these are congenital disorders, which are cystic fibrosis, genetical disorders which are present since birth. Next, assessments done on language development in the areas assessment of developmental delays. So fourth unit discusses about the genetic conditions of adolescents and adults. So cancer genetics in the and familial cancers, involve errors of the metabolism, blood group alleles and hematological disorders, genetic hemochromatosis, Huntington's disease, mental illness. All these topics are discussed. So what is apoptosis? It is a programmed cell death after any gene DNA repair or something. Also the cell will, if the cell is not able to repair the DNA repair, so it will get apoptosis with the help of caspases. And then define hemochromatosis. In hemochromatosis, it is a iron overload, basically due to genetic mutation in a gene. Name two genetic disorders of nervous system. Fragile X syndrome is one thing, and then Huntington's also genetic disorders of nervous system. And name two inborn errors of the lipid metabolism, and then define proto-oncogene. Proto-oncogene, it is a oncogene where it will get a transformed into a oncogene. So basically, it receives growth signals for a normal growth of cells and their multiplication. But when it is mutated and if it is transformed into oncogene, there will be abnormal growth and proliferation of the cells. So services related to genetics, genetic testing, human genome project, gene therapy, uh, genetic counseling, legal and ethical issues related to genetics, and role of a nurse in a genetics. All these are being discussed in the last topic, that is unit 5. So these are the most important questions. Define eugenics and roles of nurses during genetic counseling and vectors used in gene therapy. That means a target to target a gene, we need a vector through which the gene is targeted, and then define genome and list pediatric risk factors requiring genetic testing. So, if there are any abnormal congenital anomalies, and if there is anemia, all these are risk factors in which we need to get the genetic testing done. So, lastly, we will discuss the model paper of pathology and genetics, which will give you an idea. Mm, So first question will be what is cholelithiasis, and write in detail about idiopathogenesis, clinical symptoms, signs, and what are the types of cholelithiasis. As I told, you have to describe the answer in the way they have asked. First, they have asked what is cholelithiasis. So first write the definition. So inflammation of the gallbladder due to the gallstones present in the gallbladder. And then etiopathogenesis. What are the causes of the gallbladder stones due to increase in the cholesterol levels and all? The cholesterol deposits in the gallbladder will transform into stones. So all the etiopathogenesis you have to describe in detail, as preferably in the flowchart form. And then next put a heading clinical signs and symptoms. Then write this abdominal pain, uh, all these signs in the this heading, and types of cholelithiasis, acute cholelithiasis, chronic cholelithiasis. All these types you have to describe under the last heading. So though it should not be clumsy, they should be clear and detailed, especially in the sequence of the answer. So next question will be septic shock. So you can septic shock. It can be asked for essay also. So you should be prepared if they asked if they ask the question like what is the pathogenesis of the septic shock, what are the consequences of the septic shock, the in detail like essay also, but here it is asked as a short notes. Estimate of bleeding time and clotting time. So clotting time we do with the tube method or capillary method. So we have to write the normal values of bleeding time and clotting time, and how will you estimate with the what kind of processes, and write notes on see, I've told you, know, this pathology is for here 25 marks and genetics is for 12 marks. So that doesn't mean you should underestimate the genetics. I'm just telling you, because in here only three questions, it is very tough to identify which these three questions are picked up from which topics of the genetics. So here they have given the Down syndrome, genetic counseling and its issues, and methods of sex determination. Okay, so comparatively, it's most common questions only. I mean, it's not some rare kind of question from genetics. These are the most common topics we focus on genetics. Okay. So I wanted to share you one thing. So there is a launch of this program from Prakara, Potential and Realized. So this is for 249 rupees. You can get a valid subscription for this is a trail pack for 21 days. Okay, in this video, you can get video lectures, student notes, and key terms and self assessment, and new feature we have added doubt solving and webinars. So all these features you can see in this trial pack. So this is first semester and second semester students also. You can get the applied anatomy, physiology, sociology, psychology, and this nursing foundation applied second semester, applied biochemistry, dietetics, nursing foundation 2, and applied nutrition and dietetics. Okay. So all these topics are, all these subjects are covered in this trial pack. I think definitely you should try this trial pack, because it's a Dasara holidays. So okay, just take some your precious time and watch this. Yeah, if you feel it better, then you can subscribe the main Prakara also. It is just a trial pack. I think you should all go and try this. Thank you so much.